Welcome back. You are tuned into Decode Healthcare with Harshal, and today we are diving into part 14 of our massive musculoskeletal system explainer series. So last time we tackled the surgical codes for the foot and toes, right? Well, today we're cracking the code on a completely different animal. We're getting into the application of casts and strapping. That covers the CPT code range from 29,000 straight through to 29,799. Honestly, whether you're a brand new coder or a seasoned pro looking for a quick refresher, mastering these specific rules is absolutely vital. Let's get right into it. Here is our quick roadmap for today. We're going to start with the golden guideline, break down some core definitions, map out the upper versus lower anatomy, and then finally, we'll lock down those tricky cast removal rules. All right, Section 1, the golden guideline. Okay, before we even look at a single specific code, we have to talk about the absolute biggest trap that medical coders fall into here. It really comes down to a super simple equation. Surgery code plus first cast equals no extra code. Seriously, the absolute golden rule of casting is this concept of bundling. The very first cast or splint that gets applied during a fracture surgery or reduction is completely bundled into the surgical code. Let's put this into plain English with a real-world example. Say an orthopedic surgeon takes a patient to the OR, fixes a broken arm, and physically puts a fiberglass cast on that arm before the patient even wakes up. Well, you do not bill for that cast application. The work, the time, and the expertise to put that first cast on, it's already fully included in the payment for the fracture surgery itself. So you might be wondering, when are we actually allowed to use these codes? Well, your new formula is this. Replacement cast equals bill the 29,000 series. If that exact same patient comes back to the clinic, let's say 3 weeks later, and the doctor removes the old sweaty cast and puts on a fresh, clean replacement cast, boom, then you bill it. You also use these 29,000 series codes if the doctor applying the cast is a totally different provider, someone who didn't actually do the fracture care. So the main takeaway here, the first cast by the operating surgeon is essentially invisible for coding. Replacement casts or casts done by a non-operating doctor are exactly what this section was made for. Moving on to Section 2, core definitions, casts versus splints. We really need to clearly distinguish between a cast and a splint. A cast is made of hard plaster or fiberglass, and it wraps a full 360 degrees entirely around the limb. It's a solid, totally enclosed, rigid shell. A splint, on the other hand, is only rigid on one side. Imagine a hard piece of fiberglass just resting on the back of your arm, which is then wrapped in a flexible, elastic ACE bandage. Why does this matter clinically? Well, because splints allow for swelling. You'll see splints used constantly in the ER right after a bad injury because the limb is actively swelling up. Putting a 360-degree hard cast on a swelling limb in the ER would act like a tourniquet. It would literally cut off circulation and be incredibly dangerous. Now, our third category is strapping. And strapping is completely different from casts and splints because it totally lacks that hard fiberglass or plaster shell. Strapping relies entirely on non-rigid taping or specialty webbing. It's used to temporarily restrict movement in a joint or limb. So instead of a hard physical barrier, it's basically holding things tightly in a specific position just using tension. Section 3. Upper versus lower, where anatomy really matters. The codes from 29,000 to 2958 are strictly, and I mean strictly, organized by body area and length. The CPT codebook actually physically splits the codes right down the middle of the body. The upper extremity and body codes, they live in the 29,000 to 29,280 range. That's your shoulders, arms, elbows, wrists. But once you drop below the pelvis, you enter the lower extremity codes, and those run from 29,305 down to 29,584. So your absolute first step as a coder is just identifying which half of the body you're even working on. Once you figure out which of those two anatomical buckets you're in, the exact code is dictated by the length of the material. For example, we have body casts. Code 29000 is for a halo-type body cast, which stabilizes the head and neck. In the upper extremity, the codes clearly differentiate between a long cast, one going all the way from the shoulder down to the hand, versus a short cast going just from the elbow to the fingers. In the lower extremity, we see codes for massive applications, like the hip spica, that's code 29305, which wraps around the torso and goes all the way down the leg to stabilize the hip joint. Splints are categorized the exact same way, long arm versus short arm, long leg versus short leg. Basically, the more anatomy you cover, the different your specific code will be. Now, a really prime example of lower extremity strapping is the ANA boot, assigned to code 29580. And, despite what the name might sound like to a beginner, this is absolutely not a hard physical plastic walking boot. An ANA boot is actually a specialized, medicated zinc oxide paste bandage that a clinician tightly wraps around a patient's lower leg. It acts as a non-rigid strapping mechanism, mostly used for patients dealing with venous stasis, severe leg swelling, or open ulcers. It applies compression to help with circulation and healing, which perfectly fits our definition of strapping. All right, last but not least, Section 4, Cast Removal Rules, covering codes 29700 to 29750. Okay, there is a massive compliance caveat here that you absolutely need to commit to memory. Are you ready? Doctor who applies it equals free removal. I really want you to burn this into your mind. If the exact same doctor who put the cast on your patient is the one who eventually takes it off, that removal is bundled. It is totally 100% free in the eyes of the billing world. You absolutely cannot bill a removal code if it's the same provider. The CPT guidelines consider the eventual removal of that cast to just be a standard, inherent part of the initial application service. In fact, this rule is explicitly stated in the guidelines. It says, codes for cast removals should be employed only for casts applied by another individual. There's no gray area here, folks. You only ever use the removal codes if a completely different doctor or a totally different clinic is safely cutting that cast off. So think about it like this. If a patient breaks their arm and gets casted while on vacation in Florida, and then they fly home to New York to have their local doctor remove it, well, then that New York doctor can absolutely bill for the removal. Now, if you do meet that requirement of being a completely different provider, here are the specific codes you're going to use for removal or repair. Code 29700 is for standard removal or bivalving. Bivalving simply means the doctor uses a cast saw to cut down both sides of the cast, splitting it into two halves to relieve pressure. Code 29730 is for windowing a cast. This is literally when a doctor cuts a small window into that hard fiberglass shell so they can check on an underlying wound or a surgical incision without having to destroy the whole cast. And finally, code 29740 is for wedging a cast. Wedging is super fascinating. It's when the doctor cuts a horizontal slit into the cast and inserts a tiny wedge to slightly change the angle of the healing bone. And again, they do this so they don't have to apply a completely new replacement cast. And just like that, we have successfully wrapped up our explainer on the application of casts and strapping. You now know the golden rule of bundling, the core differences between casts, splints, and strapping, and those super strict guidelines for removal. But before we go, I have to leave you with one question. Are you ready for the magical world of cameras and tiny incisions? Because next time in part 15, we are leaving the plaster behind and diving straight into endoscopy and arthroscopy, covering codes 29800 to 29999. It is a completely different set of rules, and trust me, you won't want to miss how we decode it. Be sure to subscribe so you don't miss out. Keep learning, stay focused, and I'll see you in the next explainer.